In pediatric ophthalmology, we often see kids who are unable to identify optotypes. This may be because they are too young or have developmental delays. Therefore, tests have been developed to assess vision in these patients. These types of tests are called fixation preference tests and help to identify when there is a preference for one eye over the other, which helps determine the need for amblyopia treatments such as patching. There are two methods in performing fixation preference testing, the first being induced tropia. Induced tropia testing is performed when no obvious strabismus is present. If the strabismus is less than 10 prism diopters, induced tropia can be performed. To perform this test, you will need to use a prism. The prism can range from 10 to 20 prism diopters. However, the most often used is about a 14 or 16. The larger the prism, the more obvious the movement will appear. The prism can be held one of two ways, base down or base in. The reason the prism is held in these directions is to allow for the best view of the eyes. When holding the base, you will watch for the eyes to move up, and when holding base in, you will see the eyes move towards the apex of the prism. The ideal response is that either eye will move when prism is introduced. This would be a central steady maintained response. If when introducing the prism to one of the eyes do not move, the response would be recorded as central steady unmaintained. Other responses are possible as well. For example, if a patient has nystagmus, they would be considered unsteady. This will be talked about in more detail in future presentations. Now let's move to some examples. In this first video, you will notice that the prism is being held base down. When placed over the right eye, both eyes move up towards the prism. When shifted to the left, both eyes also move up. This would indicate a result of CSM, right eye and left eye. This next video shows the prism being held base in. When the prism is placed over the right eye, the eye shifts to the right, and when held over the left eye, the eyes shift to the left, again indicating a result of central steady maintained right eye and left eye. The next method that will be discussed is fixation preference. This is done when patients have an obvious manifest strabismus, and this test is done by occluding the original fixating eye and removing the occlusion to see if the patient can maintain fixation. In order to be considered maintained, the patient must be able to hold fixation through a blink. If they blink and the eye goes right back to crossing or drifting, they would be considered central steady unmaintained. If they hold fixation through a blink, they are considered central steady maintained. In the next example, you will see a patient with esotropia. Notice as the left eye is covered, the right eye moves to pick up fixation. However, once the left eye is uncovered, it goes back to the original position of crossing. This would indicate that the right eye is central steady unmaintained. Fixation preference is a tough skill to master and will take lots of practice. Feel free to try your skills on a cooperative patient in clinic that may have already done optotypes in order to gain confidence. Thanks for watching.